Good afternoon. Thank you for the opportunity to present our work. My name is Efrain Martinez. I would also like to thank my co-author, Dr. Mankiris. Tracheal and subglottic stenosis, whether acquired or congenital, remain a significant clinical problem. Our work presented here is an attempt to elucidate the basic mechanisms of luminal cricoid expansion. To date, we have identified that the luminal expansion of the murine cricoid cartilage is in part dependent on the presence of its luminal epithelial layer and possibly its perichondrial layer as well. Also, we have identified transforming growth factor throughout the trachea and subglottis. When it is exogenously added to a culture medium, it generates a statistically significant luminal expansion of the cricoids. Further analysis of those cricoids demonstrated a relative low chondrocyte apoptosis, suggesting that there may be another mechanism primarily responsible for luminal expansion aside apoptosis. Since apoptosis did not seem to be the primary mechanisms, we hypothesized that extracellular matrix digestion may be playing a critical role. To further assess how the lumen expands, we chose to study extracellular matrix digestion using immunohistochemistry of matrix metalloproteinase concentration in the murine cricoid cartilage, as well as the effects of exogenous TGF-beta3 in the enzyme's concentration. In general, MMPs play a critical role in extracellular matrix digestion. They are also essential for tissue resorption, remodeling, and morphogenesis. In order to test this hypothesis, we used subglottices from 15 neonatal mice divided in 3 groups, as you see in the schematic representation. Group A is 5 rings with their luminal epithelium left in place, grown with basic medium with no growth factors added. Group B is 5 rings with their epithelium removed, grown with no growth factors added, just in basic medium. And Group C is 5 rings with their epithelium removed, grown with TGF-beta3. The rings were grown for 13 days in culture. In groups B and C, we partially removed their perichondrium to determine if MMPs containing within the underlying chondrocytes has some effect, and if that concentration within the chondrocyte could be affected by exogenous TGF-beta3. At the beginning and end of culture, we measured lumen of the rings. Luminal cross-sectional area was calculated using the formula for an oval. The rings were then paraffin embedded and sectioned in the axial plane. MMP's concentration was established by immunohistochemistry. This is an example of a ring that grew in culture with TGF-beta3 for 13 days. The left image is the ring photograph at day 1 of culture, and the right image is the same ring photograph at day 13 of culture. When we compare luminal expansion in all 3 groups, we found the largest in rings treated with TGF-beta3. All groups appear to grow, but most dramatic growth was noted in rings with TGF-beta3. Immunohistochemical analysis in Group A, that is those rings with intact luminal epithelium, demonstrated the highest MMP2 and 9 signal in the inner perichondrial region, a bright signal in adjacent chondrocytes, and a gradual decrease toward the perichondrium in signal intensity. In Group B, that is those rings without luminal epithelium, demonstrated loss of MMP2 and 9 signal in the inner pericondylar region only in areas where the pericondyl was denuded. And group C, that is those rings without luminal epithelial layer grown with TGF-beta3, demonstrated a strong MMP2 and 9 signal, suggesting that TGF-beta3 reestablished or maintained MMPs within chondrocytes. Maintain of MMP signal in rings treated with TGF-beta3 was statistically significant when compared to rings without luminal epithelial layer and similar to rings with intact luminal epithelium. In conclusion, we found that the highest concentration of MMP is located luminally within the cricoid and gradually diminished toward the ring periphery. Because the lumen of the ring has to expand, the MMP differential suggests that these proteins are likely playing an active role in normal luminal growth. Furthermore, we also identified that the presence of pericondyl is required to maintain MMP2 and 9 within the chondrocytes. And lastly, TGF-beta3 appears to reinstate MMP2 and 9 signal in spite their loss secondary to loss of pericondyl. And also we suggest that TGF-beta3 is a significant candidate protein for effecting luminal expansion, and that it does so by influencing MMP activity as opposed to apoptosis. Thank you.
Thank you for that lovely talk. I'd like to next go to Dr. Wilhelm, who will be discussing comparison of the incidence of subglottic stenosis between, sorry.